It is estimated that 22 million Americans suffer from obstructive sleep apnea. 80% of these patients are left undiagnosed. Out of the 20% that are diagnosed, only about 50% of these patients are compliant with effective treatment options for their obstructive sleep apnea. This means that only about 10% of patients with obstructive sleep apnea are receiving proper treatment. This is mainly due to the public's, the patient's, and the professional's lack of knowledge regarding obstructive sleep apnea and its various treatment options. When most people hear someone snore, they think of it as something funny or a petty annoyance, but in reality, it is one of the main symptoms of obstructive sleep apnea. This is just an example of how many people do not know about obstructive sleep apnea or do not realize the seriousness of the disease. The disease does not only affect how a person feels during the day, but it can lead to diabetes, high blood pressure, high cholesterol, heart attacks, and strokes. Sadly, it is not uncommon to hear of stories where a patient brings their sleep study to their general practitioner that says they are unable to read or understand it. This may leave a patient extremely confused. A patient may wonder how serious obstructive sleep apnea is if their own doctor has little to no knowledge about it. The patient has no way of receiving treatment unless they seek out a professional who does have knowledge about obstructive sleep apnea, and sadly, this may be tough to do depending on their location. Even if all patients with obstructive sleep apnea were diagnosed, only around 50% would be compliant with treatment. This is once again mainly due to a lack of knowledge. Since many medical professionals and patients do not know much about obstructive sleep apnea, many believe that the CPAP or the continuous positive airway pressure machine is the only treatment option. Studies show that less than half of patients are compliant with the CPAP machine. Compliance rates could be significantly raised if patients were made aware that there is an alternative to treatment with the CPAP machine. This alternative is known as oral appliance therapy. Oral appliance therapy is much less invasive. It is practically a retainer that moves a patient's jaw forward. The Center for Sound Sleep conducted a study that reported that 91% of patients were compliant with oral appliance therapy as a treatment for obstructive sleep apnea. The CPAP machine is said to be a bit more effective than oral appliance therapy, but both are recommended and FDA approved for the treatment of obstructive sleep apnea. The spread of knowledge is the beginning of a chain reaction that will end up leading to an increase in patients with obstructive sleep apnea receiving treatment. If the word is spread about the severity of obstructive sleep apnea to the public and to medical professionals, then many more patients will be diagnosed. If many more patients are diagnosed, then more will seek treatment. If medical professionals are knowledgeable, then they will make sure that the patient is aware of the CPAP machine and oral appliance therapy as beneficial potential treatment options. This will therefore raise compliance rates. It is absurd that such a serious disease is only being treated by 10% of its beholders in the 21st century. Make a difference and spread the word about obstructive sleep apnea today.